Hello, I'm Dr. Kyle Ballou. Thank you for watching this video. I wanted to take a couple of minutes today to tell you how diabetes might affect your feet. Diabetes is a treatable but not a curable disease, as you know. There are many ways that diabetes affects your body, and there are many ways that it affects your feet. Let me just expound on two ways today on this short little video. The first way is circulation. Diabetes will affect the small vessels in your body. So any organ that is fed the blood supply by small vessels might be affected. So the diabetes will cause your small vessels to close down even more and limit the amount of circulation to a part. Secondly, diabetes affects your nerves. There are 6 different ways it can affect your nerves in the feet, but let me talk about the 2 ones that I see the most. The first is hypersensitivity, which means that you will feel everything even more exaggerated than it really is. It could even mean that you have some pains at night in bed and they wake you up or they feel tingly or numb. We have some medicines that can treat this, and it needs to be evaluated to ensure that diabetic neuropathy is the cause of this problem, but we do have some successful treatments for this. The other way, the way that I feel is far more significant to me as a doctor, is hyposensitivity, which means you cannot feel the small stimulus that might affect your feet. So if you had a pebble in your shoe or a wrinkle in your sock, or possibly you've got a toe that has a bony prominent area and the shoe rubs it, you might not feel that. Now, yeah, you would feel it if you stuck a nail in your foot or hit your foot with a hammer, but you might not feel the more subtle stimulus. A small, subtle stimulus that is left undetected over 2 hours can cause tissue damage that can result in ulcerations. Ulcerations are small or large wounds in your feet that can extend all the way down to the bone. They can become infected and cause amputations. If you were to get one of these wounds and then your blood supply was also affected, it would take a long time for this to heal, and it may not ever heal. This can lead to several complications, including amputations. It's very important for a person who has diabetes to check their feet every day to look for the warning signs of some irritation or some beginning stages of a problem, such as possibly ingrown toenails or thick calluses or hammer toes. All of these things can be devastating if you have diabetes. If you do have diabetes, I would urge that you be seen by a podiatrist at least once a year, and I recommend twice a year, to evaluate the status of your neurological system as well as your vascular system. This just might help you a little bit with knowing a few things about diabetes, but if you want more information, I've recorded another video that goes into more detail about these situations. I hope this helps, and if you need some help with your evaluations of your feet, please give me a call. I'm always willing to help. I'm very passionate about treating my patients who have diabetes. Thank you.